Speaking of confrontation, Democrats don't like it. Joining us, Democratic Congresswoman from Pennsylvania, Allyson Schwartz. Congresswoman Schwartz, welcome to the show. Thanks for joining us.
Absolutely. Good to be with you. And good luck to your pregnant lady there.
Oh, thank you very much.
Congresswoman, over the weekend, the big news from first the president, essentially signaling over the weekend that the public option on healthcare reform, it's only a small part of the issue, which I think is nonsensical. And then his folks going out on the Sunday shows, namely Health and Human Services Secretary Kathleen Sevilla, saying it's not essential. Kent Conrad saying that there aren't the votes in the Senate for the public option. Obviously, over the weekend, the message sent, we're giving up the public option, and healthcare stocks getting a nice kick today as a result of that. Healthcare companies obviously relishing that news. Why has that happened, and is there a way to reverse it, and do you think it ought to be reversed?
Well, I've been supportive of a public option. I think that it is one piece, but an important piece as we, in particular, as we move forward in making sure that we not only contain costs, but that we make sure that there is meaningful coverage for every American. And that means, particularly those who are small groups, individuals, those who really have the hardest time finding meaningful and affordable coverage in the private market. It's not been a group that the insurance industry has been too interested in really providing coverage for, and that in many areas of the country, as you may well know, there's not a lot of competition, and making sure that there are choices for Americans who will be asked to buy insurance, that there are affordable choices, and that they're fully meaningful is important, and I believe that is a mix of private and public.
Right. Well,
options.
so how do we?
So I'm still for a mix of those options. I think it's important. I think it's still on the table, and I don't think it's been written off yet by certainly not by the House of Representatives yet.
Well, of course, but it does no good if it never passes the Senate. And I'll be honest, I got to disagree with you about whether it's still on the table. When the president says it's off, that sort of says your leader has given up the fight.
Well, the president, according to White House talking points, I didn't talk to him personally over the last 24 hours, but has said that nothing has changed, that the president has always said that it's essential that health insurance reform lower costs, that he still thinks the public option as an option for people is the best way to do that. Now, that he has always said he's got to see what legislation the House and the Senate can come up with. Certainly his administration has been engaged in these discussions as well. And all I can say is from my point of view, I certainly am working towards and hope that a public option is a part of what we do. It is certainly true that we are doing a lot of important work at least in the bill that's been drafted by the House. And look, we don't even have a Senate bill yet. And one of the committees hasn't even voted a bill yet. That we actually also make sure that the American people know that in private insurance and of course a public option, but that we're changing some of the rules of the game here, that we're not going to let the insurance companies be able to exclude people with pre-existing conditions, charge extra for health status, go back and look for some reason to deny you coverage, and to charge people a whole lot more based on health status.
Well,
so, those rules are important, and I think one of the points that I would agree with that was made over the weekend is that we need to assure Americans that the insurance that they are buying now is going to be more meaningful, and it's not going to exclude important coverage. So whether that's in a public option or a private option, that's important as well.
Well, I mean, I agree with you. I see a sense, though, that not necessarily from you, but that, for example, today the S&P Managed Healthcare Index of large U.S. health insurers was up 4%, 3.8%, soundly outperforming the 2.5% decline for the broader S&P because they know the message was sent. They know they won, and I know you know what that means. But before we talk.
Yeah, you certainly are absolutely right that the insurance industry and the Chamber of Commerce, which I understand less, by the way, are absolutely opposed to a public option. Now, what's good about that, if you want to put the best spin on it, is that they're saying that they're going to step up to the plate and provide meaningful, affordable coverage under these new rules to Americans that they've not been very interested in insuring in the past. Now, I think, again, as you pointed out, I believe there has to be a public option to create that competition and a non-profit option so that, we really have at least one of the options for Americans is
Yeah, you got
an option that says that they're not looking to make a profit here. So yes, there's certainly the insurance industry would love for us not to have a public option.
Yeah, and we need to create that competition, that incentive. That seems so obvious to me. But that said, I want to play a clip for you from it's of a colleague of yours, Mike Ross from Arkansas, and he was at one of these forums, and first you're going to hear a kid ask him a rigged question. And then he's on CNN, right, JR? And I just want you to, and I'm not asking you to, I won't ask you to single out him, but I want to talk about the politics of this healthcare debate in general, because I think, as usual, the left is getting the living crap beat out of it, and they're terrified of what people on the right are going to say about him, and I think this just exemplifies that, and then I'll ask you to respond to it in broad terms. Trust me, I won't ask you to pick on a colleague, but here's the clip.
Mr. Ross, I want the same opportunity that you had. Please don't load me up with debt that I can't pay.
Now, you voted in committee to keep the process moving, to get the House bill moving along, to keep it moving after you got some concessions. If that bill were on the full House floor tomorrow, based on everything you have heard back home, including the concern there about deficit spending, would you vote yes, or do you need additional changes?
Well, I think we probably need to see a few more changes to it. Let me say this, that I'm glad to see all people, young and old, starting to talk about the debt. I've been talking about the debt for 9 years. Let's not forget here, it took George Washington to Bill Clinton to put this country $5 trillion in debt. It took the last president to double it. And so I'm one of those that have said, one of my key principles is I will not support a health care reform bill that is not deficit neutral, period. I can tell you I've laid down my set of principles. I will not force government-run health care on anyone. If there ever is government-run health care, the first ones to sign up should be the president and every member of Congress, including myself. You should be able to keep the insurance you've got today if you like it, and always choose your own doctor. No federal funding for illegal immigrants or for abortion, and no rationing of health care. I will never vote for a bill to kill old people, period.
Mr. Ross?
All right, so that was Congressman Mike Ross from Arkansas. And what happened in that, in my mind, we're talking to Congresswoman Allyson Schwartz from Pennsylvania. He's a fellow Democrat. And what happened there is we have a situation where Democrats end up responding to the most outrageous allegations the right makes and never framing the issue ourselves. I'll never vote for a panel to kill old people. Well, there isn't one. No one in their right mind would suggest it. Why can't we go on these shows ever at any point and say, they're liars? The people who say it's a death panel, lying. Of course there's not going to be a death panel. What kind of crazy nonsense is that? And he ends up talking about, no, please, we're not going to pay for illegal immigrants and there won't be any abortion. Just, why can't we talk about what we want and not respond to what they claim we want?
Well, some of those have been trying. First of all, hearing what Mike Ross said, he could vote for this bill because the bill actually does not add to the deficit, and it is paid for. And we tried to come up with what we thought was the best way to do that. I'm certainly open to different ways of paying for it, and certainly all of us would like to make sure that we are serious in keeping the costs down. And we are. Some of the changes that some Democrats wanted actually added to the cost, because we actually, for example, think the public option will help bring down the cost, both not just for government, but for families and businesses. I mean, we're trying. I completely agree with you. We're going to be talking about what is really good in this bill. I'll tell you one thing. I outlined to a member of the press some of the good things we're doing. The fact that we are really creating new incentives for primary care physicians and nurse practitioners, that we are, there are ways in this bill that we actually are really working hard to make sure that getting health insurance is affordable for all Americans, but it's also meaningful, the way I've already talked about it. When the reporter said back to me, well, you're just talking about the things we already agree on, not the disagreeable ones. I
Well,
said, well, that's right, because that's most of what's already in this bill.
But why
you
don't?
know,
But to make that point, and I don't doubt that there are great things in the bill, and like everyone else who's on the radio or on television talking about this bill, I haven't read it either. But that said, you're losing the political fight, and we always lose these political fights. I think in large part, and if Cenk were here, he would make this point much stronger than I do, because we're not punching back in the face.
What would you have liked to have heard from Mike Ross?
Death panels? I'm not an idiot. I don't support a death panel, and the people who mention death panel, including Iowa Republican Chuck Grassley, the senator who the Democrats inexplicably try to court, he's a liar. Chuck Grassley's a liar.
It's so hard to trash a kid.
Well, the kid, I don't think they
yeah,
do
he's
that.
certainly not the kid.
Maybe Miss Joe the
I
plumber.
also agree, and I have said this is a lie. There is no government bureaucrat who's going to be making decisions about your coverage or denying your coverage. That's not in this legislation at all. The notion that it's a bad idea or leads to rationing for our seniors, that we actually, what we did, and you know this, is that what they're talking about is the fact that there's a new provision in the bill that would allow a reimbursement for a consultation with a doctor or a nurse to talk about a patient directive, which really means you as a patient would be able to write down on a piece of paper, it's called living will, patient directive, to be able to say what you would want done or not done if you were terminally ill.
Well, look,
end of life. And that, I mean, that is not a major part of this bill, but many of us think, and I'm one of them, that having that kind of conversation before you're sick, when you have
Yeah, I asked for a living will as a wedding
it's a
present.
good idea.
yeah, well,
I
of
did.
course it is, but I don't know a rational American who would think that's a bad idea. But if they're going to frame it, and they've already successfully framed it, because they understand that when you talk about death panels, and when Sarah Palin who doesn't no way accidentally talks about death panels, all they've done is created what the cigarette companies tried to do in 1957, which is say, I'm making the year up, by the way, which is say, hey, there's a lot of, I don't know, some people say it causes cancer, some people say it doesn't. We don't know. The jury's out. So now all they want Americans to go is say, death panels, I don't know, that doesn't sound good to me. Maybe we just should keep things the way they are. And then they succeed. They've succeeded, and part of it is because we're afraid to get into a street fight.
Well, but even when we do call them on it, and I watched a couple of those shows, Sunday shows as well, then when I heard the Democrat calling on a Republican who was saying that, these terrible things could happen, and he said, well, where in the bill does it say it? It doesn't say any of that. And the Republican said, well, there's 6 pages that talk about this, and I've only had a month to read it. It's like, excuse me, I think you could probably read 6 pages in a month. And, he tried to refute it, and the moderator said, it sounds like you're just arguing. The fact is, you're right. There is truth in this, and there's untruth in this. You called it a lie, that's certainly true. And so it's, we need to be absolutely clear about this. What we want to do, though, is to get back to talking about what really, all of this bill, all parts of it it's good for us to be having a debate, but you're absolutely right, we should be having a debate about the reality of what's in this legislation, what we're attempting to do, and the people who are fighting it so actively, the ones that you hear about bringing up these simply things that are not true, don't want us to do this at all.
Well, Congresswoman,
they're hard to say, nope, we don't think people should get insurance. Too bad, you're on your own.
Yeah, well, Congresswoman, I don't want to seem dismissive, because I do appreciate the fight you were taking. I think until we get willing to, if you don't want to call Chuck Grassley a liar, you say stop lying at the very least, and others like him who are in fact much worse. But Congresswoman Allyson Schwartz, I fear the public option died a death this weekend. I think that we'll all be admitting that in the coming days. I hope it didn't, but
did it die because of Obamacare?
But
we're going to keep working. We're going to keep fighting. We're going to keep working all that we can to make this the health care reform that we know Americans need, and that's those weeks away.
Well, Congresswoman, keep fighting, but it may get ugly, and don't be afraid to get ugly. Thank you for joining us today on the Young Turks.
Watch more clips at theyoungturks.com.